Here's an explanation of the process involving a bag valve mask system during ventilation. Expired air diversion and bag re-expansion in BVM system. Expired air diversion. When the patient exhales, their expired air is directed away from the bag and is vented to the atmosphere through a one-way valve. This ensures that the exhaled carbon dioxide does not re-enter the bag. Bag re-expansion. The bag needs to re-expand to be ready for the next breath. This re-expansion happens through different sources depending on the setup. Atmosphere. If the BVM is not connected to any external device, the bag will re-expand by drawing in air from the surrounding atmosphere. Reservoir bag. If a reservoir is attached, the bag will re-expand by drawing in oxygen from the reservoir. The reservoir helps in delivering higher concentrations of oxygen to the patient. Continuous flow from oxygen tubing. If there is oxygen tubing connected, the bag will re-expand by drawing in oxygen supplied through the tubing, ensuring a continuous and higher oxygen flow. This system allows for efficient ventilation, ensuring that the patient receives adequate oxygen while preventing the inhalation of exhaled air. Let's break down the process of bag valve mask, BVM, ventilation and the role of the one-way valve in maintaining effective ventilation. Two-hand mask hold with two providers. Technique. Using the two-hand mask hold with two providers ensures an effective seal of the mask on the patient's face and keeps the airway open. One provider uses both hands to hold the mask in place, while the other provider squeezes the bag to deliver breaths. Advantages. This method is especially effective in maintaining an adequate mask seal and minimizing fatigue for the providers. Oxygen concentration. Reservoir system. When a reservoir system is attached and oxygen flow is maximally increased, the BVM system can deliver an oxygen concentration of approximately 85%. The reservoir bag stores extra oxygen, ensuring that the patient receives a higher concentration of oxygen with each breath. Bag mask ventilation. Adequate ventilation and oxygenation. Properly performed bag mask ventilation provides the necessary ventilation and oxygenation to a patient requiring airway support, ensuring that the patient receives sufficient air and oxygen to maintain their vital functions. Patient's expired air and bag re-expansion. Expired air diversion. When the patient exhales, their expired air is directed away from the bag and vented to the atmosphere through a one-way valve. This prevents the exhaled carbon dioxide from re-entering the bag and being inhaled again. Bag re-expansion. Atmosphere. If the BVM is not connected to any external device, the bag will re-expand by drawing in air from the surrounding atmosphere. Reservoir bag. If a reservoir is attached, the bag will re-expand by drawing in oxygen from the reservoir, providing a higher concentration of oxygen to the patient. Continuous oxygen flow. If oxygen tubing is connected, the bag will re-expand by drawing in oxygen supplied through the tubing, ensuring a continuous and higher oxygen flow. This system ensures that the patient receives adequate ventilation and oxygenation while preventing the inhalation of exhaled air. The two-hand mask hold with two providers is a technique used during bag valve mask, BVM, ventilation to ensure a tight seal and effective ventilation for the patient. Here's how it works. Technique. First provider. The first provider uses both hands to hold the mask on the patient's face. CE or VE grip. The thumbs and index fingers form a C or V shape around the top of the mask, while the remaining fingers lift the jaw to open the airway, jaw thrust maneuver. Seal. This grip creates a firm seal between the mask and the patient's face, ensuring no air leaks. Second provider. The second provider squeezes the bag to deliver breaths. Compression. They compress the bag at regular intervals to provide ventilation, ensuring that the patient receives adequate oxygen with each breath. Advantages. Improved seal. Using both hands to hold the mask helps create a better seal, reducing the risk of air leaks. Airway management. The jaw thrust maneuver helps maintain an open airway, especially important in patients with potential airway obstructions. Minimized fatigue. With two providers, one focuses on maintaining the mask seal and airway, while the other manages the bag, reducing overall fatigue. Application. This technique is particularly useful in emergency settings, such as during cardiopulmonary resuscitation, CPR, where effective ventilation is critical.